The heart of rural America, where the fields are wide and the skies stretch endlessly, a quiet crisis has taken root, one that affects communities, families, and individuals in ways too painful to ignore. The opioid epidemic has ravaged the nation, and rural America has not been spared. One American dies of drug overdose nearly every 5 minutes around the clock. Opioids like fentanyl and heroin are involved in most overdoses. The opioid overdose epidemic is claiming lives every day, and rural areas, with their limited resources, are particularly vulnerable. Across these towns, lives are lost every day to drug overdoses. Lives full of potential, full of promise. Yet, in these close-knit communities, help is often miles away. Access to treatment, support, and even basic emergency services can be a challenge. And when the call for help comes, seconds matter. As the crisis deepens, the need for a more accessible, scalable solution has never been clearer. As part of a broader array of solutions, harm reduction strategies have gained significant emphasis in recent years. For example, 17% of opioid overdose deaths in Illinois had at least one non-fatal overdose in the prior 12 months, indicating a significant gap in harm reduction interventions, such as prevention of overdose fatalities among people who actively use drugs and those who are undergoing addiction treatment and recovery services. When breathing stops in an overdose, brain cells start dying after 5 minutes without oxygen. However, the median time for an ambulance to arrive is 7 minutes in the U.S. It takes over 14 minutes in rural areas, and even 20 minutes or more in very rural locations, such as some southern counties in Illinois. As local emergency services do not have the capacity to provide necessary services in a timely manner, community empowerment initiatives play a crucial role in preventing overdose fatalities. In response, efforts to distribute naloxone have gained traction, and lives are being saved. Community leaders, healthcare professionals, and emergency responders have rallied together to ensure that this life-saving medication is within reach. Yet, for all the progress, a pressing challenge remains. How can we ensure that individuals, especially in rural areas, are not only equipped with naloxone, but also adequately trained to use it when it matters most? This is where innovation steps in. Introducing Virtual Reality Naloxone Training, VeNT, is an innovative approach to opioid overdose response training. This groundbreaking solution harnesses virtual reality to provide an immersive, hands-on learning experience, equipping participants with the skills necessary to save lives in overdose situations. VeNT uses mixed reality, a version of virtual reality, VR, to offer an interactive and highly engaging environment that simulates real-world overdose scenarios. Mixed reality combines digital imagery with the real world in front of a user's eyes to recreate the experience of an actual situation of an overdose. The advantage of mixed reality over virtual reality is that it allows users to see and interact with virtual objects, but simultaneously, they will also be able to see their real-world surroundings. For example, trainees can practice using a real naloxone spray on a virtual patient in their environment and conduct cardiopulmonary resuscitation, CPR, on the virtual patient, and even see how the patient reacts when recovered. Unlike a physical mannequin, participants can practice recognizing the signs of overdose, administering naloxone, and calling for help, all without the need for physical training setups or costly in-person simulations.
Hi there. In a moment, you're going to experience a hands-on training.
What sets VeNT apart is its ability to replicate the highly stressful environment of an overdose situation. Users are guided through the steps of recognizing and responding to an opioid overdose, including the critical action of administering naloxone. This immersive approach builds both the confidence and competency needed to respond effectively in the moment. This is the first research study to use mixed reality technology for naloxone training. The blended experience aims to avoid feelings of isolation that can occur in a completely virtual environment and avoid feelings of anxiety that can occur in a completely physical environment. Additionally, training participants are able to use real-world objects in a virtual environment. This approach will increase the likelihood that users can draw upon their memory from the experience if they must save a real victim, regardless of whether it is on a street in a big city or on a farm field in a small town.
911, what is your emergency, please?
For example, big cities have naloxone hot spots, and VeNT can bring that environment to the person so that they feel familiar with it. Then, participants can draw upon their memory if they must save a real victim. Assumption is that after people go through this simulated immersive environment that will teach how to use naloxone, they will feel more confident and less panic when they help an actual overdose victim. By offering a hands-on experiential learning process, VeNT empowers users to practice and retain vital life-saving skills in a safe, controlled setting.
Congrats! You've completed the overdose rescue training.
The power of VeNT lies in its accessibility. For rural communities, where resources are limited and training opportunities are few, mixed reality makes this crucial training available to everyone. With VR headsets and a simple interface, community members can learn to respond to an opioid overdose in real time, without leaving their local area. This technology transcends the barriers of geography, providing rural communities with the tools they need to make a tangible impact. But VeNT isn't just for the general public. It's also transforming the training process for first responders, healthcare workers, and emergency personnel. By simulating high-stakes situations, VeNT provides professionals with the opportunity to refine their response strategies and better prepare for real-life scenarios. This kind of immersive training is invaluable for those whose decisions can mean the difference between life and death. From teachers to parents to community volunteers, anyone can be trained to save a life. This is the power of VeNT, providing not just education, but a transformative tool that enables anyone, regardless of their background or profession, to act decisively and effectively in the event of an overdose. By adopting this innovative approach, rural communities are not only increasing their preparedness, they're also building a stronger, more resilient response network. VeNT is more than just a training tool. It's a vital resource that's helping to shape the future of overdose prevention in underserved areas. As we look toward the future, it's clear that collaboration and innovation are key to tackling the opioid epidemic. Through VeNT, we're empowering communities, strengthening response capabilities, and providing the opportunity for second chances. One life saved at a time.